Welcome to this episode of Health Vision. Today, we are at the Information Technology Optimization in Healthcare Conference in San Juan, Puerto Rico. And we're going to soon be hearing from our experts on what they provide as far as information technology in healthcare and how their solutions are going to be changing in the rapidly changing healthcare field.
I think there's a recognition that healthcare costs need to be managed a little bit more. You know, if we look at the patients that are using a lot of the costs, it's patients with multiple chronic conditions or with complicated medications, and there's a strong need to be able to manage the care of those patients as they move from the hospital back out into the community, or as they get medications prescribed from multiple physicians. And the concept of things like medical homes as a way of controlling these costs, all of this needs good coordination of care and therefore information exchange between all the providers. And finally, I think the final thing that's sort of happening is the patients are realising too, you know, they're starting to ask questions, why is it when I turn up to my doctor I have to tell him the medications I'm on? Why doesn't my doctor know what medications I'm on and treat me appropriately? So I think all of those things come together. Of course, the current administration's focus on that is very heavy, so all of that means that health information exchanges have really come to the forefront in the last 2 years. One of the big barriers to adoption in terms of sharing information between systems is really the concept of interoperability. How do all these disparate systems communicate effectively and reliably when they're sometimes talking different standards? And there's two things that's happening. One, in the healthcare industry in general, there's a strong drive for more interoperability. And number two, the tools by Orion and other vendors are really designed to be able to let these systems talk to each other. There's quite a long lag time in that. You know, they're found in Canada, they still have hospitals that have systems that are 5 or 6 years old. So you need to have tools that can integrate not only the new modern systems that are all certified and interoperable, but also a lot of the legacy systems still need to be integrated into your overall solution. But primarily the ROI is going to come from the reduction for hospitals in terms of reduction of ER admissions, because the patients can be better managed, the reduction in the stay in those ER, and finally the administrative side of things. There's a lot of, a lot of organisations spend a lot of time right now sending faxes, phone calls, all this sort of time that, although it's all little, it adds up in a physician's day. And by removing all of those little costs and improving this communication, that's really where the ROI is going to come from.